Next part of lecture is deep caries or hyperemia of pulp. This name, deep caries, is according to clinical topographical classification and according to International Classification of Disease, it corresponds to the code K04.00 and it is called initial pulpitis. It is different code. It is not caries because of changes in the pulp, and according to international classification it corresponds to pulpitis and calls initial pulpitis K04.00. But according to the clinical topographical classification it is deep caries. According to Silverstone, there are the same pathomorphological zones like in medium caries: decay, microbial avantgarde, demineralization, sclerosed dentin, intermediate, substitutive dentin, but more pronounced changes in the pulp due to depth of the cavity. Caries cavity is deep, so first changes start in the pulp. Clinical manifestation of deep caries. Also, there are basic methods and additional methods. During basic methods, we collect complaints, and there are three options of complaints. First, there are no complaints. Second, there may be pain, more often from temperature and less often from chemical irritants due to vasospasm. And the third option is aesthetic defect. During inspection, we may see discoloration of the affected area, presence of caries cavity, and localization of defect. In probing, we can find that it is painful all over the bottom of the caries cavity. The whole bottom is painful and percussion is painless. As for additional methods of diagnostic, there are temperature tests. It's also painful but short term, like in medium caries. In X-ray picture, there is K4 type of cavity, and electroodonto diagnostic parameters, they may be higher than in the norm. In frontal teeth, there are from 2 till 15 microamperes, and in posterior teeth, there is 7 till 25 microamperes. Differential diagnosis of deep caries provide with 3 diseases. First, medium caries. Second, acute focal pulpitis. And the third one, chronic fibrous pulpitis. 1 caries and 2 form of pulpitis. And in detail, you can see differential diagnosis in the table. Our disease, deep caries, and 3 differential diagnosis disease: medium caries, acute focal pulpitis, and chronic fibrous pulpitis. And there is sign: pain during deep caries. It is causal and short term. In medium caries, the same, causal and short term. And in pulpitis, there is spontaneous and long-term, and in chronic fibrous pulpitis, causal and long-term. It's difference in pain. Deep caries causal short-term, and pulpitis, it is different. As for the depth of cavity, in deep caries it's deep, in medium it's medium, and both in acute focal pulpitis and in chronic fibrous pulpitis it's also deep. Probing in deep caries, it is painful all over the bottom. In medium caries, it's painful on enamel dentin border. In acute focal pulpitis, it is painful only in one point of the bottom, which is closest on the pulp, to the pulp. And in chronic fibrous pulpitis, it is painful in one but opened point of the bottom. Temperature test. In deep caries, it's short term, and also it's short term in medium caries, but it is long term in pulpitis, in acute focal pulpitis, and also in chronic fibrous pulpitis. As for electroodontal diagnostic, in deep caries it may be till 20 points, whereas in medium caries it is like in norm tooth, from 2 till 10 microamperes. And as for pulpitis, the parameters are higher, till 25 in acute focal pulpitis and from 25 till 40 during chronic fibrous pulpitis. X-ray picture gives us K4 cavity in deep caries, K3 in medium caries, and it may be K4 or K5 cavity in acute local pulpitis, and K5 cavity in chronic fibrous pulpitis.